Hey everybody, this is Dr. Jordan Adrian with Limitless Concierge Physical Therapy based in Denver, Colorado. And I just wanted to take a moment today to cover one of the most common questions we get asked as physical therapists. And this is how do I deal with some of the pain and or limited motion that I have associated with my osteoarthritis as it's starting to impact some of the activities that I really love doing, whether that's just going out for a hike, whether that's playing in the yard with your kids. It can definitely be something that's can be detrimental to your quality of life. It doesn't necessarily have to be. So one of the biggest things I tell people is find some sort of movement that feels good for you. So even if it's not feeling great immediately when you're starting off, as you get going for a minute or two with respect to like aerobic exercise, should start to loosen up, feel a little bit better. And so for a lot of people, that can be riding a stationary or a recumbent bike, or if you have access to a pool, being able to get and walk in that water, especially if it's a warmer pool, like a therapy type pool, can be great, as it helps to heat the joint and reduces the amount of weight that's going down into the joint with the buoyancy of the water, depending on how deep that water is that you're walking in. And so that's one of the biggest things that we recommend. Because with arthritis, we start to lose or have a breakdown of some of the cartilage where the bones come together. That cartilage is normally very slick and allows those bones to glide smoothly over one another. As we start to lose this, those bones don't slide or glide nearly as smoothly over one another, and we rely more heavily on some of the fluid inside of the joint to act as a lubricating factor. And this is what movement can help us with. So I like to say, motion is lotion. So hopefully that helps stick in your mind the importance of just overall general movement and helping to reduce arthritic related pain and improve mobility. One of the second thing that I'd like to talk about with regard to osteoarthritic pain and mobility is potentially using like a neoprene type sleeve if you're having pain in your knee, ankle. Even I believe they have some for the shoulder now at this point in time. That sleeve is going to help to retain some more heat around the joint, as well as provide a little bit of gentle compression, which can be reassuring. That retention of heat can help to keep tissues pliable, can help to keep the joint a little bit more mobile, and feel a little bit more supported, which can decrease your pain and increase your tolerance for activities. So first thing, go ahead and make sure that you find a movement that feels good for you, that you can repeat on a daily basis. And then the second thing is maybe look into something along the lines of a neoprene sleeve to be able to help retain some of the heat and some of the mobility of the tissues around the joint too as well.